Lebanon County Emergency Management.
Good morning, Joe Morales, Deputy.
Jeff Yoakum, Coroner.
Okay, good morning. Go ahead.
Morning. We have two items today for the Commissioners. The first being to accept the Hazardous Materials and Response Fund grant, which we applied for earlier this year, a sum of $17,546.75. Also worth noting that that's the highest amount we've ever received due to the work of Hazmat Chief Gary Murray.
Tell you what, he just keeps on showering us with good things from his efforts. So it's good. We need a motion, Bill.
I'll make a motion to accept the grant as presented.
Second.
There's been a motion and a second to approve the 17-18 Hazardous Material Response Fund grant. Any questions or comment regarding that?
Just comment that on one of the pages it outlines what the items being, what the grant's being utilized for, which are mostly meters and calibrations.
Yes.
For their equipment.
Hazmat Response Equipment Refresh.
Okay. If there's nothing else, all in favor, please indicate by saying aye. Aye. Opposed, same sign.
Aye.
Opposed, same sign. So moved.
Next item we are applying for a county-wide Narcan distribution grant. We would also like to become the county coordinating entity to manage that grant. I'm going to defer to Deputy Morales to tell you more about that.
Good morning, Commissioners. This morning I'd like to give you a brief overview of the Naloxone to First Responders program. The Naloxone for First Responders program is coming to us through the Pennsylvania Commission on Crime and Delinquency, PCCD, in collaboration with the Pennsylvania Department of Drug and Alcohol Programs, Pennsylvania Department of Health, and the Physician General. And what it is a $5 million program over a 2-year period where they will distribute kits over the entire, or throughout the entire Commonwealth, all 67 counties. Now, naloxone is a medication that has been proven to reverse the effects of opioids on the brain and respiratory system to prevent death. Since November of 2014, there have been more than 3,800 overdose reversals in Pennsylvania as a result of naloxone administration by law enforcement alone. The kits will be provided directly to one centralized coordinating entity, or the CCE, per county. No funds will be released. PCCD will serve as the purchasing agent and ship the kits directly to LEMA once we're designated as the CCE. And then, of course, LEMA will distribute to our first responders throughout the county. The anticipated start date for the program is November 15th of 2017, and then run through November 14th of 2019. We're currently scheduled, Lebanon County would receive 15 cases for the first 6 months, equaling 360 doses. The number of kits was determined by a formula that included variables such as population, opioid overdose deaths, and overdose reversals using naloxone. And comparably with the counties around us, we're right in line with the number of kits that they'll be receiving. LEMA was required to get a prescription from Dr. Yoakum, which we've received, which is part of the application process. What will happen is for future distribution amounts, that'll be determined based on the use and saturation levels in Lebanon County. What will happen is these kits will be distributed biannually over the next 2-year period. LEMA, as the CCE, will be responsible for determining community needs and distribution of the naloxone. And there's a long list. Just about everybody is
Semi-annually or biannually?
Biannually. Yep. And there's a long list of first responders that are eligible, and it goes through schools to library personnel. I mean, we can pretty much push it out to a large amount of folks. LEMA, as the CCE, will be required to report the number of kits provided to whom, the total number of doses of naloxone administered, the number of individuals naloxone was administered, and the number of naloxone administrations resulting in overdose reversals. So that'll be our responsibility at the county level, which we as a CCE will take care of. And so what we're here today to ask the commissioners is for your approval to be the centralized coordinated entity, CCE, for Lebanon County, so we can administer these kits.
Yes, I do have a question. Joe, before I make a motion, which it sounds wonderful, but I do have a question or two. EMA is obviously locked down as a unit. You are obviously in charge, but do we further have security for this storage of these 360 kits, number one? And number two, must it be refrigerated?
Yeah, it has to be deferred.
I do not have the answer to the refrigeration.
How about the
But
lock?
We would be able to secure those.
Yeah, we have a safe that we can secure it in, but from a storage requirement standpoint, I really don't believe there are.
No,
No refrigeration?
no,
Okay.
no.
That would, okay, then I'll make a motion to proceed.
I'll second that motion.
Been moved and seconded that we apply for this designation. Any questions beyond what we've had? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign, so moved.
And then second action item is approval to apply for the grant itself.
Okay, Bill, would you make a motion for applying for the grant, or is that?
Yes, I'll make a motion to apply for the grant.
The CCE is the designating of us as the
Oh, so first we
distribution
designated you,
entity.
we're doing two separate motions. Okay, I thought it was all in one. I'll second the motion then.
Okay, this is the grant side of it. Any other questions? If not, all in favor, please indicate by saying aye.
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 Opposed, same sign, so ordered.
Thank you for your support.
Okay? Thank you, gentlemen.